Hi everybody, welcome to Healthline. I'm Gregory Zarian. Happy New Year. Can you believe it's the end of January, already going into February? How were your holidays? How was your New Year? How many healthy intentions have you set yourself, have you set up for you in 2017? Here at Healthline, we believe in the word intentions, not resolutions. Resolutions, you set yourself up to fall with an intention. They're just baby steps to leading a healthier, happier lifestyle. Are you intending to drop some weight? Are you intending to get more healthy? Are you intending to spend more time with your family? With every intention turns into habits, and habits turn into healthy choices. So here's to a happy, healthy 2017. So we are just on the brink of February, and February's Heart Health Month. How healthy is your heart? What do you know about your heart? Do you take care of your heart? Do you work out? Do you keep it strong? Or do you kind of fall on the other side and just don't keep it as healthy as you can? With it being Heart Health Month, we decided to bring you the best of the best from Glendale Adventist Medical Center. He's a regular on the show. He's Dr. Harry Balian, heart specialist, and joining us for the very first time is Dr. Amir Rafie. Doctors, welcome.
Thank you for having us.
So good to have you. Heart Health Month. What's the most important thing, Dr. Rafie, that you want to share with us about our hearts?
The beating heart is a fundamental sign of life. So when you think of the way I see the heart, just 1 month after conception, your heart starts to beat non-stop, almost one beat every second through your life. And if you live up to 70 years old, your heart has beaten 2 billion times, non-stop. So to me, it's very important that we pay attention to this organ in our body that contributing to our life.
Well, contributing to who you are. I just say, for
Yeah.
all of you, give yourself the goal of going for 2 billion beats. That's exciting, Dr. Balian.
Our hearts are the most vital organ. I mean, maybe I'm biased because I'm a cardiologist, but without the heart, the life does not exist. And our hearts are very sensitive. I mean, if you look at the coronary arteries, which supply blood flow to the heart, they're at the size of the tip of your pen. So when you're not taking care of yourself, you're not exercising, you're smoking and don't have a good lifestyle, it's very easy for plaque buildup in your arteries, and then heart attacks come. It's not just a heart attack that potentially may kill you, it's having a heart attack and becoming a cardiac cripple. And then you're basically in and out of the hospitals with a very poor heart function, and you have fluid buildup in your lungs. And that is a miserable way to live. It's a slow death, and it's a miserable death. So,
Well, I say we don't strive for a slow death, and I say we, at least if anything, go shoot for 70, 2 billion heartbeats. Okay, when we come back, more with Dr. Balian and Dr. Rafie. And I have a question. How many times does your heart beat a day? I will give you that answer when we come back. Do not go away. Welcome back to Healthline. I am Gregory Zarian. So it's all about the heart. February's Heart Health Month, and I left you with a question. How many times does your heart beat every day? So I have the answer. It beats 80 times per minute, 4,800 times per hour, over 115,000 times a day. How great is that? Now, if you want your heart to beat consistently like that, what you have to do is keep your heart healthy. Joining us is Dr. Harry Balian from Glendale Adventist Medical Center and Dr. Amir Rafie, both heart specialists. First of all, Dr. Amir, welcome.
Thank you.
Dr. Rafie, when we first started, we said, when somebody gets to the age of 70 years old, it's over 2 billion heartbeats, and we want to go way past that. How does someone keep their heart healthy, off the top of your head?
The way I look at the heart, when I explain it to my patients, I always explain it in a way that heart has 4 components. So we are talking about the heart muscle, the way the heart pumps. We also talk about the heart valves, which are basically, they are remarkable. They are very thin membranes that regulates the blood flow through the heart. And we also I tell them about the electricity of the heart, and also the coronary vessels, the blood supply to the heart. So thinking of each single component of the heart, there are different diseases could affect them. So
Well, you said 4. So 1, 2, 3. What's the 4th?
So I would the heart muscle,
Heart muscle,
the valves,
valves,
there would be electricity, of
Electricity.
the heart, and it would be the blood vessels that supply blood to your heart.
and the blood vessels. And one thing you said earlier was it's all about prevention.
Yeah. So the prevention. So we just want to make sure we have a healthy lifestyle, reduce our cardiovascular risk factors, such as high blood pressure, diabetes, smoking, which are all contribute to atherosclerotic process, which is the process of building plaque
And one
inside
thing,
the coronary
well, Dr.
arteries.
Balian, one thing we've talked a lot about is plaque buildup here. Same thing for you, of course, leading a healthy lifestyle and prevention.
It's important to change your mindset. You know, a patient or a person has to say, you know, a sedentary lifestyle, which unfortunately a lot of us have, being sitting in the office or whatever else, they have to make an effort to get themselves to the gym. I know Dr. Rafie and myself, we make an effort to be at the gym
Well,
at
both
least
of you
4 or
are
5 times a day.
both of you are in great shape. And one thing I want to say is we've talked about this. There's a lot of people that live sedentary lifestyles,
Right.
especially like I can't work and I can't do this. Well, for people per se that live in an office, that work in an office, you get an hour lunch break.
Right.
Instead of taking the elevator, take the stairs.
Correct.
Walk around the campuses of your job. Walk to and from when you go to the mall. Do things. You can do something to elevate your heartbeat every day.
You have to elevate your heart rate to
Heart
the
rate.
extent that your metabolic rate stays up, and that's how you burn the calories. So if you're taking more calories than you're burning, you're going to store it as fat. That's a commonsensical statement. But I think with that said, you have to make an effort at least 3 to 4 times a week to do cardiovascular exercise where you're actually elevating your heart rate 20 to 30 minutes by at least 120, 130 beats per minute, and that way you ensure that your metabolic rate stays high. So that's a mindset, a lifestyle change that you have to do. Other things, such as not smoking. I mean, smoking is a toxin that we're putting in our bodies. Yes, it's very addicting, but that's something that they have to absolutely modify. Unfortunately, in Glendale, in our community, a lot of our patients are addicted to cigarettes.
It's also cultural. And
Right.
I smoked, you know this, I smoked for 20 years, 2 packs a day. And I made a decision to just stop. And people say, oh, you have no idea how hard it is. Yes, I do. 20 years, 2 packs a day, and I didn't, unfortunately, I saw my mom pass away. So it's a choice. And I love that you said it's just changing your thinking, because somebody doesn't wake up, other than hereditary maladies, somebody doesn't wake up obese. We contribute to being obese. We contribute to heart disease. We contribute to everything that we are. So with every excuse, there is a solution. So if you feel that you've put on a little bit of extra weight during the holidays, make a choice and do something different. Before we dive into the topic, doctors, why heart health? What is some of your schooling, Dr. Rafie?
So I did my medical school back in Iran, Tehran University. After that, I was at Stanford for a few years, did research in vascular medicine. I did my residency at Yale School of Medicine. Then I came here to California. I was at Cedars-Sinai for my cardiology fellowship. Then I went to UCLA for my interventional cardiology fellowship, and I'm so glad that I'm here in Glendale. Amazing community. It's a great privilege for me to be here.
It holds a very special place in my heart. Being with my dad being the former mayor, and Stanford and Yale. Do you have T-shirts from there? Could I have the T-shirts? Dr. Balian, you've joined us a lot on this show, and I always love seeing you. Share with us some of your medical history.
I did my med school in Chicago Medical School, and then I was at UC Irvine for my medicine. I was chief resident there, and then I did my cardiology again at UC Irvine, where I was chief fellow, and I did my interventional fellowship at George Washington. So I've been in practice for over 10 years, actually 11 years, and I've been very blessed to be part of this community and to help my community. And the hospital, Glendale Adventist, has given us every opportunity to enable us to deliver the best care to our patients. So again, we are very fortunate to of where we are, and we are able to deliver our skills for the betterment of our patients.
It's great to have both of you with us. When we come back, Dr. Balian and Dr. Rafie are going to share with us what the TAVR procedure is. And it's here in Glendale. More about you, your heart, and heart health when we come back. Don't go away. Welcome back to Healthline. Did you know that Glendale Adventist Medical Center was ranked 4 out of 5 stars by the Centers of Medicare and Medicaid Services for its star ratings? That's the top 20% in California. So the topic today is all about affairs of the heart. How healthy is your heart? Joining us is Dr. Harry Balian and Dr. Amir Rafie from Glendale Adventist Medical Center. And I feel like I'm with the United Nations because they both speak quite a few languages. Dr. Balian, what languages do you speak?
I speak Armenian,
fluently,
and I speak Spanish actually fluently, and I also speak Arabic, French, and I understand and speak a little bit of Turkish.
And you're great looking. Okay, Dr. Rafie.
I stick with English and Farsi.
English and Farsi, and you're great. Okay, like seriously, like the best looking show we've had here on Healthline. And if you want somebody that speaks German, I could participate in surgical procedures. So doctors, one thing that you said, Dr. Balian, is, you know, here in Glendale, culturally, there's a lot of smoking. And what is the one thing that you want to say to people that smoke in regards to their heart health?
I tell them every time you take a puff of the cigarettes, the nicotine itself is actually causing your arteries to pinch. It's almost like you're taking pliers and you're pinching your vessels. And that implies the vessels of the heart, the brain, the vessels of the lower extremities. So anybody that has any kind of vascular disease, smoking is basically toxin. It's like pouring matches, gasoline and matches together, especially if they're diabetic or they have other comorbidities. Nicotine is the absolute worst thing you can do. So if you're smoking and you have vascular disease, you're basically at a loss, and your life is going to be shortened by many, many years.
And it just doesn't happen. So here's the thing, make a choice, put your cigarette down. Dr. Rafie, what is cardiovascular disease?
So we talk about the 4 components of the heart. So technically, any disease that involve any of the components of the heart,
Okay.
and also the vasculature. So when you think about the vascular disease, the main process, the main reason for having the vascular disease would be atherosclerotic disease. We talk about the risk factors, cardiovascular risk factors, such as lack of exercise activity, smoking, high cholesterol, poor healthy eating,
how important
diabetes,
sleep is, water, all of it.
Exactly. So a lot of anxiety. So mental health also contributes to your cardiovascular health. And thinking about the heart disease, of course, the same way that atherosclerotic disease could involve any of the vessels in your body, could involve the coronary arteries. So that would cause the patients to have angina, plaque formation, and in the worst case scenario, the patient could have a heart attack because of the plaque rupture. Usually is the main cause for that. Could also have a disease of the valves.
So bottom line, what one thing can turn into to a lot of things. Heart health, February, all about conversation, and I want to get as much information out there about the heart. There's a procedure that's happening at Glendale Adventist Medical Center, the first in the community, called the TAVR procedure. Dr. Balian, what is that? And congratulations.
TAVR, thank you very much. We're very proud to have brought this technology to the community, and we started doing our first TAVR procedure in early November, and we've done so far, I believe, 8 or 9 cases, and they're very successful, and we have a lot more planned to go. So TAVR is basically transaortic valve replacement. It means that we are replacing the aortic valve without having to cut the chest open, and this is a huge advancement for not only patients' safety as far as a decrease in hospitalization days, and making it overall very convenient for a patient to have a replacement of one of their major components of their heart without having to undergo major heart-lung bypass machine, etc. So we're actually able to do this procedure just simply going from the groin, the artery in the groin, just like having a stent put in your arteries of the heart. We're able to deliver the stent a big stent across the aortic valve and deploy it, and basically that it has a valve within the stent. So essentially, they can have a major operation without having to undergo the traditional
cutting through the chest and doing all of that.
Correct, exactly.
Who is eligible for this procedure? Is it somebody that has heart disease? Is it someone that has too much plaque? Who is eligible for this
So
procedure?
patients with severe aortic stenosis.
What is stenosis, doctor?
So basically, as we talk about the different components of the heart, so we have four major valves in our heart. The tricuspid valve, pulmonic valve on the right side of the heart, mitral valve, and aortic valve on the left side of the heart. Basically, aortic valve is the valve that is the way I see it is a door from the heart to the aorta. That actually,
I love that.
And just imagine that that door could not open very well. So all the blood that wants to come out of the heart,
It backs up.
it backs up, and the end result would be the heart failure. We know that majority of these patients with severe aortic stenosis could be asymptomatic, or wrongly we could call them asymptomatic by people who say that, oh, just grandma, it's just the symptoms of aging. But we know that when the patients get to the point that they become symptomatic, and these symptoms are chest pain, angina, syncopal episodes like passing out, and heart failure symptoms like progressive heart failure, this would be considered as a fatal disease because 25% of these patients, only being on medical therapy, would die within the first year. And within 2 years, more than close to 50% of these patients would die. We know that the 5-year survival for these patients with severe aortic stenosis who have become symptomatic is less than 20%.
So is it hereditary? Is it someone that has a sedentary lifestyle? Is it age?
There's no necessarily there's no hereditary component unless the valve itself, they're born abnormally. The valve has 3 leaflets.
Okay.
So some people are actually born with 2 leaflets. We call that bicuspid valve. And usually these people in their age 30s and 40s, they have a loud murmur, and by age 50 to 60, they need a replacement of this valve. So that's a hereditary, I mean, there's no hereditary component, it's a congenital defect of the valve. There is also such a condition as a unicuspid valve, which is very rare, where the valve has only 1 door instead of 3 doors. And those people usually in their 20s or 30s years of age, they need a replacement of the valve. So this is a wear and tear of the valve. In fact, 80% of people in their 80s have some level of aortic valve stenosis or narrowing. So it's a calcium buildup, just like if you look at the parts in your car, or anything else, as time goes along, there's a wear and tear in different parts of your body, and namely your valve. And aortic valve being one of the most pressurized valves where the heart is pumping against it, you're going to inevitably have calcium buildup, and the calcium causes the leaflets to stick to one another. So essentially that door doesn't open. So when the door doesn't open properly, you're going to have inadequate blood flow to your brain, inadequate blood flow to your lower extremities, and that's how people pass out.
And bottom line is you just want the door to open. More with Dr. Balian and Dr. Rafie when we come back. Don't go away. Welcome back to Healthline. Did you know that Glendale Adventist Medical Center has been recognized as one of the best hospitals by the U.S. News and World Report in 8 categories for 2016, heading into the year 2017? The topic is all about affairs of the heart, and we were talking to Dr. Harry Balian and Dr. Amir Rafie about the TAVR procedure. Doctors, who's eligible for it? Dr. Balian?
As far as eligibility, people that have severe aortic stenosis, meaning their aortic valve is narrowed to such an extent that we classify it as severe. Normal aortic valve area should be more than 2 centimeters squared. Okay. So when you have a valve area that is less than 1 centimeter squared, that's categorized as severe aortic stenosis.
Well, you talked about the tip of my pen.
Those are the coronary arteries.
Got it.
So just look at the size of a dollar coin, I would say. That would be maybe a little bit smaller than what the aortic valve should be. Just that kind of a guesstimate. So when that valve is narrowed and you make an estimation of valve area being less than 1 centimeter squared. Now, of course, we also measure a gradient, and I don't want to get too technical, but when you have severe aortic stenosis and the patient is symptomatic, meaning they either have been passing out, they have chest pain, or they have heart failure. Heart failure being the most critical symptom of severe aortic stenosis.
Okay.
Their mortality is shortened, as Dr. Rafie said. In fact, people that have severe aortic stenosis with heart failure, their mortality, 50% of these people die within 2 years.
Wow.
So these people are eligible for valve replacement. Now, traditionally, Medicare had set guidelines to say only the high-risk patients are eligible for the TAVR procedure as opposed to the traditional valve replacement. High risk meaning high frailty score, people that you look at and they're just very much not amenable to traditional surgery.
Got it.
Whether they have long-standing lung disease.
Well, the bottom is they just can't survive it.
Right. So they go through surgery under the heart-lung bypass machine and general anesthesia. They may never wake up.
Okay.
So those people were deemed as inoperable, and they actually just were left to eventually die, unfortunately. And now there's an option for these people. So when Medicare first approved, or FDA approved this procedure in the U.S., they only offered it to the high-risk patients. So those high-risk patients were the ones that had higher frailty score. They were older, and they were actually assessed by two cardiothoracic surgeons as not operable candidate.
Okay.
So as early as 3 or 4 months ago, the FDA guidelines changed. Now they actually offer TAVR procedure to patients that are intermediate risk, meaning whoever is eligible for the traditional valve replacement surgically, they're also eligible for the TAVR procedure. So that actually opens the doors to a whole bunch of patients that can have the surgery or the valve replacement done either through traditional surgery or the stent valve procedure.
If you have the procedure, what are some of the complications to it? Are there complications, doctor?
Yes, there are complications to procedure. This procedure, as you could have complications to any other procedures we do in cardiology. The main complication, we are talking about the vascular complications, bleedings. The contrast that the patients receive during this procedure is very limited, so the contrast-induced nephropathy or damage to the kidney would be very low. Patients, during the deployment of the valve, there could be a rupture of the aorta, and at the time, again, the deployment of the valve, there could be some leakage around the valve, and patients could have a stroke. But we are talking about this is a very safe procedure.
Love that.
When you look at the data that we have for intermediate risk patients, we are talking about a stroke and overall mortality less than 1%.
That's awesome.
Which is almost 75% less than conventional TAVR, which is surgical aortic valve replacement. So this is amazing.
What are we looking at recovery time?
Less than 2 days.
Less than two. So I go in.
You
I
go
have this
in, you get
procedure.
your procedure, and
Okay.
then you go to the you go to the intensive care unit where you're awake, you're bedridden for a few hours, and then after that you can actually eventually sit up to the chair, and then the following day you're in the telemetry unit walking around. Technically, you can go home that same evening or the following day. So less than 48 hours, the patient is ready to go home.
And how much time, you basically physical therapy or a physical therapy of sorts, how much physical therapy would there be, and then you actually feel like you have your life back as it was?
I mean, this is the only discomfort that you would potentially feel is the actual puncture site in the groin artery.
Okay.
And then we make a decent sized puncture site when we're introducing the sheath, which is 14 French, I would say about 3-4 millimeter hole in there, and we actually suture that. We deliver a suture from the outside, so there's no cutting. Sometimes if the artery is so calcified or hardened, they actually do a cut down procedure where they actually expose the artery and then put the sheath in. But there's no sternotomy, the chest is not cut open. So within a few days, I mean, the patient is up and about, and then you're able to walk, and within a week you're back to your normal activities, I would say.
Since we're short of time, doctor, what are signs and symptoms of a heart attack for a man? Just because we've talked about the heart, and a lot of people think maybe chest pain or this and that. Dr. Rafie, what are signs and symptoms of heart attack for a male?
Would be severe chest pain,
Okay.
sweating, shortness of breath, feeling doom, and
Panic.
exactly.
Dr. Balian, for a woman?
Women have atypical symptoms of heart attacks, so a lot of them are misdiagnosed because of that. So just indigestion, nausea, weakness can be misidentified, and so actually can be signs of a heart attack in women. So that's why we have to pay very close attention to all the signs and symptoms when people coming into the emergency room. So that's why EKG should be done promptly, and they should be definitely taken seriously. Any kind of symptoms of nausea, weakness, indigestion can be a sign of a heart attack.
Anything that feels off, doctors? Your final thoughts in regards to keeping your heart healthy?
As we mentioned before, just try to stay active and healthy diet, and just think about reducing your cardiovascular risk factors. Low cholesterol, make sure that diabetes is well controlled, hypertension is very well controlled. Do not touch tobacco in any form, I would say, and enjoy your life and smile.
Dr. Balian?
You are what you eat. So if you eat a lot of bonchik, your heart's gonna be turning into bonchik. That dough. So you have to watch your diet, exercise, cut out all the risk factors that are modifiable. Stop smoking. God has given us certain genes that we cannot control, but we can actually do something active about not smoking, going to the gym 3-4 times a week, and really watching our diet. So that way we can stay healthy, we can be around for our families, and live happy and prosperous.
Doctors, it was an absolute pleasure. Thank you so much. So make it a healthy one, and please feel free to incorporate more of us at Healthline into your lifestyle. You can visit us on YouTube at GAMC Healthline, and also follow us at Facebook at Glendale Adventist, and also Twitter at GAMC Health. And we're also listed on LinkedIn. And for more information, please visit us on the website www.adventisthealth.org/Glendale. Take care and keep your heart healthy. We'll see you next time.